Hello, everybody. Hi, I'm Andrew. This is Professor Simon Au. He has been training thousands and thousands of family medicine. Was really honored to have him to provide us a real good picture. What is the COVID-19 affected all the people who are typical people plus all the people who are pre-diabetic and diabetic. And this is going to be a very, very really informative webinar for all our friends here, plus people from United States, because today I already noticed that people from United States, from Philippines, from Singapore, from Hong Kong, from Malaysia, has a lot of different people. So we have hundreds of people attending this webinar. So this is really wonderful. The important thing is what we try, our objective is try to give you folks a real non-biased information. And thank you, Mahuba from Philippines, Cebu. Thank you very much for joining us. But we want you to actually have a real good, excellent information so you can make a good decision and understanding whether to go to vaccine. And if you do vaccine, what will be good for you and why it's actually is good for your friend and yourself and so forth. So you will really have a good answer this time. So that's the objective. Hello, Angela Lowsutea President. 嗱，好多謝咧，今日Professor Simon Au 啦，佢訓練咗千聲嘅家庭醫生，咁我同佢合作咗一段時間嘅，咁佢係 very knowledgeable 咧喺尤其是喺COVID-19 裏邊咧打咩針好啊？咁今日嘅 objective 咧就俾一啲information 俾你咧，能夠有一個正面嘅睇咩嘅打針點解會好，同埋打咩針係好重要，同埋對你身體上有咩影響。因為太多堂友翻嚟話俾你聽，哇 Andrew 我好驚喎，有三高喎，唔打得針我會死喎。咁呢樣嚟講咧係好多呢啲係全部都未必係即係正確嘅知識嚟嘅。咁希望我俾咗呢個正確知識，咁你能夠真係自己去一個好啲嘅 information 啦，咁你自己就能夠 good for 一個係一個好嘅 understanding 啦，咁佢對你嚟講係十分好嘅。咁今日我哋嘅講座係咁嘅，咁我依家就交呢個成個講座俾Professor Simon Au， 咁我依家就拎個slide 咧就過嚟咧 share 俾你哋 ，OK？ 嗱，等等啦，咁我依家 share 過嚟啦。So we're going to share the slide now, and then we'll go from here. Okay, Professor, we're going to start now. So, 講中文、講英文人中文 ，OK, okay, good.
Okay, thank you, Andrew, for your kind introductions. I think probably everybody is worried about COVID-19 at the moment. And the picture here, we can see the COVID-19. You can see, we can use a brief introduction of the virus. 嗱，我哋好簡單，好多謝 Andrew 介紹咗我啦嚇。我哋講一講咧，大家都好擔心嘅呢個 COVID-19 個病情啦。嗱，呢個圖表咧有個 COVID-19 嘅公仔喺度嚇。咁 this is a structure of the virus. You can see this is a lot of spike here. Can you see? And this is the whole virus itself. And inside is contain lots of genetic materials. 嗱，呢個就係 COVID-19 個結構啦。佢有好多啲蛋白，我哋叫做刺針蛋白啦。咁入邊咧，佢就會係有多啲嘅遺傳基因喺度嘅。How it infected our human cell is because usually they through the spike protein. You know, they get into contact with our cell, and then once it got into our cell, then the genetic material go into our cell and multiply, and causing all the infections. 咁佢主要靠呢個蛋白嘅刺針蛋白咧，就黐落我哋人嘅細胞嗰度，跟住咧啲遺傳物質咧就可以咧入咗我哋細胞複製繁殖，跟住造成一個傳染。咁點解要咁講咧 ？Why we have to mention this? Because we have two different vaccines at present. So one is the inactivated virus vaccine, and the other one is the mRNA vaccine. It's all related to how we have to understand how the virus like. 因為我哋個病嗰啲咁嘅疫苗咧，佢哋而家有呢個滅活疫苗啦，同埋有啲叫 mRNA 疫苗啦。我哋明白佢個結構咧，我就明白我哋點解會打針嘅。咁我一路繼續講落去 ，we'll go and continue now. So we look at the incidence rate. 可唔可以 share the screen I'd like to share the screen just now with you all.
Okay, go. I'll stop sharing this, and then I'll freak this out again. I'll share this screen, right? Okay, we'll share the screen now. Okay. Share again. Okay. So share the screen. Can people see that screen now? Let me see. Double check. Oh, no, really. Okay, good. Now it's okay.
You can see the figure here is a worldwide screen. You can see that it's all a trend, and there's another trend. And now probably we worry about the third one because the Indian variant. 你見到咧，突然間爆咗跌咗去又升翻啦。我而家開始全世界都講緊會唔會啲印度流感啦。咁你睇到咧個疫情咧到而家為止咧，睇到下低個 worldwide case 咧死咗係3點，要 have already 3.9 million deaths, and it's 180 million cases, maybe even more. I think probably most of the country will be underestimate the figures. 咁我哋知道咧，而家差唔多咧有係1.8億人咧係惹咗病，而390幾萬人死咗。咁你 you can go down and see the number one country is the US. Okay, you can see India is coming up. Probably sooner or later become the first one. 印度係第2啦 ，then Brazil, and then France. 咁其實個疫情仲係 now the disease is still booming because you worry about the Indian variant. 個 disease 仲係喺度爆發緊嘅，所以我哋咧要好小心去留意呢個病。好，我哋翻去個 slide 嗰度。
Okay.
Go back to the slide PowerPoint.
Okay, thank you. Okay, let's see. Okay, I'll stop sharing again. And then we have to share your PowerPoint one more time. Okay, now I think it's okay. Okay.
Okay.
Okay. Let me.
So it's an incident just now. So it was probably 2 or 3 months ago. Probably the incidence now is already gone up. 呢個係1、2、3月前我 prepare slide 嗰時係4月27號嗰個 slide 嚟嘅。而家再高啲。咁because we have 3 misunderstanding in Hong Kong。嗱，好多人有3個誤解。Just now Andrew has already mentioned the misunderstanding. The first one is people with diabetes, with hypertension, with high cholesterol, with a multiple chronic disease shouldn't receive any vaccinations。嗱，好多人認為三高啊、糖尿啊、心臟病啊、血壓高都唔可以打針嘅。The second misunderstanding is people too old, they cannot tolerate the vaccine。第二個咧就係覺得老咧就唔好打針。The third is the vaccination has a lot of side effects。好多人認為咧打針咧好危險嘅。咁你 look focus on this table, we can see the cases, amount of hospitalization and the death。你睇睇啦，病啊、住院啊同埋死亡嗰度。You can see the older you are, the higher risk you become. You can see people with age 55 plus. The death rate is about 8,700 higher than those with 0.4 years old。嗱，年紀越大咧，個死亡率越高喎。85歲係8,700倍死亡率。The hospitalization risk is about 95 times。住院咧就95倍機會。你諗下住醫院咧好辛苦啊！You think about hospitalization. You stay in the hospitals without a tube inside. You're going to be very terrible。嗱，呢個咧就係我哋好多個 myth 啊，就好多人覺得唔好打針。但 the myth is I think it's wrong. I want to clarify people with all those disease with old age should first consider having the vaccinations。嗱，年紀大啊、三高啲病人咧，應該係第一類要打針㗎。Like in all developed country in the world, like US, Israel, UK， 好似英國、美國啊、以色列嗰啲地方 ，all the people, the party group is belong to these patients。咦，冇咗個This is all the priority group, right？ 嗱，喺全世界咧，先進國家咧，老人家三高咧、血壓高咧，都係首先要打針、考慮打針嗰啲人嚟嘅嚇。But I still hear a lot of worry. I don't understand all your worries, so that's why I want to give you more details of what the disease like。我知道大家都好擔心打針，係咪？所以我希望咧講多少少俾大家聽嚇。So COVID-19 is not a lung disease. It's a very serious disease. In fact, affect your lung, not only affect your lungs, affect your heart, your blood vessels, affect your brain, eyes, nose, liver, kidney, and intestine。呢個肺炎咧唔係淨係肺炎嚟嘅，佢影響個肺啦， 影響個心臟啦，影響個腦啦，影響眼啦、鼻啦、肝啦、腎啦同埋腸嘅。你睇到 ，you look at these figures. According to the latest research in Queen Elizabeth hospitals, nearly 50% of the patients who recover from COVID-19, they have a nearly permanent lung damage. 有50%差唔多50% 嘅人咧，係好翻咗之後咧，個肺都係傷殘嘅 ，including the heart. And according to some of the British research, they study on about 230,000 patients who recover from COVID-19. Nearly 50% of patients have some sort of brain damage. 英國最近去做23萬個病人康復者咧，佢發覺咧差唔多一半人咧都有腦嘅受損嘅喎。而 other studies show maybe 30% of those who recover have liver damage, kidney damage, and internal organ damage. 另外30% 嘅人咧都可能有其他內臟嘅受損嘅。所以你記住呢個係一個非常嚴重嘅病。So you have to remember, it's not only a lung disease, it's a very serious disease, highly contagious, and with very serious complications. 呢個病係好嚴重，傳染性好高，同埋係好多併發病。同埋 the research now show the Indian variant even is 60% stronger than the previous one. 個印度變種咧係60% 更加勁嘅，所以大家係 so everybody have to be more concerned if you still not receiving vaccinations. 如果大家仲未打針咧，我覺得大家要仔細聽一聽啊。So as I say, the COVID-19 can cause lots of fatalities. See, in this figure, so 10% with cardiovascular disease and diabetes patient, chronic respiratory disease, hypertension, cancer. This all belongs to a high-risk group. The people with cardiovascular disease, the 10% higher chance will die of the disease, and diabetes 70.5%, respiratory disease 6.3%, hypertension, cancer are those. 年紀越大或者越多病嗰啲人咧，個風險就越高嘅。所以if anybody with those above disease, you should highly consider vaccinations. 如果國民咧有以上啲病咧，應該係考慮咧係要打針。As I say, 1 in 6 will have complications. 有啲 more than 1/6會有併發症嘅喎 ，and some are life-threatening. And we had a disease called cytokine release cytokine storm, and we probably trigger our immune system. And so that's why people suffer from sudden death, because it's suddenly all your blood vessels have been damaged, and you suddenly suffer from hypoxia. 其中一種病咧就係引發呢個併發症咧，令到你咧有個免疫系統嘅反應，令到你突然間呼吸唔到啊。You still remember in the early time, the people in Wuhan, they suddenly die on the street without any symptoms before. 你見到咧，武漢之前好多家行下都死咗啦，就係呢個問題。Is these problems? So it's still very serious complications. The second one is acute respiratory failure. 我哋有呢個呼吸嘅衰竭啦，because our lung have been damaged, we don't have sufficient oxygen, and then we die nearly immediately. 差唔多咧，所以你發覺咧，好多人咧個肺受損啦。You can focus on the slide here. This is not a normal lung. You saw the scar in here, and suddenly the lung go all damage. Within minutes of time, 可能 within days. 所以呢個病好危險㗎，個肺咧好快咧就受損啦，好短時間就死亡。So apart from the lung failure, we have pneumonia. It becomes so inflamed you cannot breathe, and loaded with fluid and pus and cell debris. 你見到如果惹到肺炎咧，個肺咧充斥晒啲膿液細胞咧，亦都呼吸唔到嚇。咁 you still remember SARS many years ago? It's an acute respiratory distress syndrome. Because of the infections, they cause all the lung damage, and suddenly you have trouble getting oxygen into the bloodstream, and eventually need mechanical support. 如果你個肺爆發嗰陣時咧，你個肺冇晒空氣咧，咪需要啲呼吸機咯。You should remember in the early times we don't have sufficient ventilator in the hospitals, so people die because they don't have life support. 我哋早期記唔記得大家都唔夠呼吸機咧，最後好多人都因為咁樣死咗。 咁 apart from lung troubles, it can cause acute kidney damage。我哋可以引起突然間嘅個肝嘅併發症嘅喎。佢哋發覺咧，英國嘅 studies 咧都有2-3成人咧係有肝嘅問題。In some studies say 20 to 30% of people suffer from liver troubles. And then apart from liver trouble, have cardiac troubles, and including arrhythmia, means your heart cannot pump normally. The virus can affect the heart and causing sudden stress. If you had your heart and your lung and your liver has done damage, I think you soon suffer from multi-organ failure and will die pretty soon. 好多時咧個肺啦、肝啦、個心臟都會受損嘅喎，所以全身嘅器官咧都好短時間內受損。That's why you older you are, the higher risk you are。你越老咧，你個高風險就越高嚇。咁apart from COVID infection, you induce secondary infection like other bacteria like Streptococcus, the aureus, that sort of bacteria。除咗你 COVID-19 會感染你咧，會引發啲併發症嘅噃。最常見就係鏈球菌同埋葡萄球菌啦。咁 if you have multiple infection in your lung, I think you are so lucky to survive。如果你突然間有幾種併發症咧 ，with your old age, with all chronic disease， 你真係好難會 survive， 好難會生存得到咯。所以你大家會記住呢個唔係一個普通嘅病。I hope to remind you all, it's not a simple disease, it's a very serious disease, highly contagious。Apart from all those small organ failure, we have septic shock. Septic shock means all the bacteria go into bloodstream, and because of circulation, they will bring all the bugs to the various organs and causing multiple infections. Eventually, the whole system shut down and causing septic shock. 即係你所以咧感染咗啲病菌之後咧，佢全身喺個血液游走嗰度，全部內臟都器官感染咧，就敗血性休克。所以 it's a very serious complication as well. Okay, then we have another horrible disease called DIC, disseminated intravascular coagulations。就係呢個咧敗血病，我哋有時叫做，就係 because the platelet count is so low, the suddenly the system cannot form any clot, and eventually 呢個 massive bleeding inside your body and causing multiple organ failure。就係呢個敗血病就因為佢 consume 晒冇晒啲血小板啊，最後咧全身咧就出血而死亡嚇。咁你諗下個病係幾緊要 ？You can see the disease is so horrible. It's not something like it's a very mild form of like flu problems. Okay, a Dutch study found nearly 1/3 of people in ICU for COVID-19 have blood clots, and they have clots in their vein, their lung, and their arteries. And causing, if their vein, they have deep vein thrombosis. In their lung, they have pulmonary embolism, which is a very life-threatening disease. And the coronavirus can cause a clotting condition called coagulopathy. So it's causing a blood vessel disease and clotting troubles. 所以咧，你 COVID-19 唔單止係內臟受損喎，同啲血管又受損，亦都無端端令到啲血管硬化咗喎。If you already have coronary artery disease or lung disease, or you further will causing the blockage。如果你本身啲氣管都塞塞地咧，你又更加塞得太快，就變咗係會死亡。So in case they say it's safer in the kids. Luckily, this disease is rather rare, but it's still causing multiple system inflammation syndrome in children. And they know that children have been hospitalization called multi-system inflammatory disease in children because the symptom causing fever, belly pain, vomiting, diarrhea, rash, headache, and confusion. It's like something like a septic shock because the bugs travel in the blood and causing multiple organ failure. You may probably heard of Kawasaki disease, which is much similar disease. 我諗住細路仔冇事喎，細路仔都可能有嚴重嘅喎，有併發症嘅喎，亦都可以喺敗血性休克或者引致川崎病嘅。所以細路仔都唔係完全係免疫，所以你頭先睇第一個表咧，細路仔個死亡率相對低好多So even you recover from the COVID disease, you suffer from a condition called chronic fatigue syndrome。你會慢慢咧好翻，或者你病唔好翻，你都會好慢性好疲勞嘅trouble in thinking, in working, in doing everything. You feel tired all day long。成身都好辛苦好翻到咁 Other rare condition called rhabdomyolysis， 呢啲嘅肌肉溶解啊。呢個 luckily is a very conditions because the muscle eventually break down and causing tissue death. And so because the muscle break down, the kidney cannot flush all the trouble and can causing acute renal failure. 呢個病咧比較少見啲嘅，啲菌咧可能破壞咗你啲細胞，溶解咗，產生大量嘅 protein， 咁個腎臟咧排唔走到咧，最後都引起腎臟衰竭嘅。咁 this cause acute renal failure. Not common but serious. You may get dialysis if you had dialysis facility in the hospitals. You can get back to work. 咁雖然唔係好常見，但係都好嚴重嘅嚇。咁但係咧 once you got damage, the kidney will suffer from some mild chronic damage, chronic disease. So you can see the disease can cause multiple organ troubles, cause blood vessel troubles. Eventually, even you recover from the disease, you may not. I think probably your life cannot be normal again. 你睇到個病咧好嚴重啊，全身都影響咗咧。即使你好翻咧，你未必可以完全康復。I had one patient. He's a 30 years old young man. He's a boxer. He's a very fit young man. Now he can barely walk after recover from the COVID-19. 我個病人咧係拳賽選手嚟嘅，佢好翻咗，而家行路都好辛苦啊。He's only 30 years old. 佢30歲啫喎，所以大家唔好睇小個病嚇。So last is probably the brain damage. In the UK, there's one study shown nearly 50% of those who recover from COVID-19, they will have some sort of permanent brain damage. 你喺英國佢做個研究發覺50% 人都永久損害個腦，其實好嚴重喎，係咪？即係個腦冇咗嚇，你冇咗。The patient gets all confusion, loss of consciousness, suture, stroke, loss of smell and taste, headache, trouble in focusing, and change in behaviour. 啲病人咧，即係好翻咗之後，你記住好翻咗之後喎，唔係病緊喎，都係啲神志唔清晰啊，或者有呢個發羊吊啊，甚至會引起中風啊，冇晒味覺、嗅覺都好慘啦，呢條簡單，仲有頭痛啊，集中注意力唔到啊，同埋好多精神都有問題嘅嚇。So, patient, I know a lot of our audience had trouble with diabetes in here, so that's why I big focus on the people with diabetes. What is people with diabetes more likely to get COVID-19? No sufficient data, but probably they will suffer from more worse outcome. So higher risk of getting serious complication.Especially older people 頭先我都講就唔係好多數據，不過有數據顯示到咧，頭先話3個病人咧係更加風險更加大，而老人家比有好多風險係更加大嚇。So do people with diabetes have high chance to get serious complication of COVID-19？ 會我哋知道會機會併發症會高啲啦。Well managed diabetes lower the risk。如果控制你個糖尿病控制得好咧，會減低風險嘅。Mild infection and poor control diabetes result in increased inflammation and internal swellings and contribute to more serious complications。當然你控制得唔好咧，個風險就高好多。唔單止係 diabetes 啦 ，strong diabetes 啦 ，all those with hypertension, heart disease, kidney troubles, they will have more serious complication with under poor control。所以控制得唔好咧，其實所有病都容易啲嘅。
I just make one comment. I know a lot of people on Facebook. Can you put a like there so we know that you are listening? 我好多朋友喺 Facebook 睇緊我哋嘅 webinar 嘅，咁或者俾個 like 我哋啊，咁變咗嚟講，知道你都聽到我哋講嘢啊，咁我想知道多啲朋友俾個 like， 好，唔該晒，多謝先。
Thank you. So based on the CDC figures.Patients with type 1 gestational diabetes may be at high risk of having serious form of COVID-19, and they will have worse outcome than people without diabetes. 所以咧，有 diabetes 嘅人咧係風險高啲嘅，大家知道啊。So do I need to sorry.
Okay.
So infected people with diabetes do face increased risk of diabetic ketoacidosis. Probably people with diabetes will heard of those. 大家有糖尿病可能聽過呢個做呢個糖尿病酮症酸中毒啦，就係因為 because people with poor control diabetes they will have high blood glucose. Eventually they are ketone in your urine. It's a life-threatening disease. 咁咧通常咧人咧控制得唔好咧，佢哋好多 ketone 咧令到咧我哋身體咧產生一個好危險嘅病嚇。So the ketone acidosis will adversely affect your food intake and electrolyte level, which is important in managing sepsis. As just I mentioned now, because people suffer from septic shock, so you make sure you have your diabetes under very good control. 咁所以咧，你發覺咧，頭先我講咪話有啲人會引起啲敗血病嘅，如果你控制得唔好咧，所以大家要好小心注意。So does COVID-19 cause diabetes? Well, it probably is associated with marked elevation of blood sugars because the body is under stress and we have remarkable degree of insulin resistance. And especially beta cell, the pancreatic beta cell dysfunction and insulin instability to dispose glucose into the cellular tissues. And it will be responsible for the accelerated development of type 2 diabetes. 咁可以話咧，發覺咧係有關嘅有少少因為咧有時可能佢 damage 埋呢啲 beta cell 咧，咁可能係有令到呢個糖尿病咧係有問題，而且令佢出現有糖尿病嘅所以大家都要注意下咁 COVID-19 what's the difference between COVID-19 and seasonal flu 同呢個季節性流感有咩唔同咧 ？As I mentioned just now, this is a more serious disease, highly contagious. You can see a table in here. The flu, the death rate is 1.3. In the COVID-19, it's probably double. And the incubation period is 1.4 days, but the COVID-19, 1.14 days, maybe even higher because you know now a lot of silent carrier around. And you can see, look at the hospitalization rate, the 2% compared to nearly 20%. It's 10 times more. In case fatalities, 0.1% is nearly 10 to 30 times more. So it's definitely not a seasonal flu. It's a much more serious form of lung infection and multi-organ infections. 呢個咧你睇到咧個比較咧流感咧嘅死亡率 1.3 倍 ，COVID-19 咧就 2.25 倍，好似睇落冇乜分別。但係睇到下低咧就發覺咧佢個住院病咧係多10倍嘅，同埋個死亡率咧呢度係 0.1% less， 呢度係 1% 已經多10倍到 3.4%， 即係其實多10到30幾倍。咁呢個係好明顯係一個嚴重多好多個病所以大家唔好掉以輕心symptom warning, I think probably most of the people will know from the news 我諗大家都知道有咩症狀，其實都知道嘅but it's similar to the flu symptoms 同呢個流感病都好相近。One is different is only the new loss of taste and smell. I think probably so that's why it's a very important question I usually ask. 其中最常見咧，同其他傷風感冒差唔多頭痛發燒流鼻水咳嗰啲但係最緊要咧就個味覺嘅消失，呢度係最特別嘅一個所以 it's like other flu symptoms. We have runny nose, coughing, fever, short of breath, fatigue, all those things pretty much similar like the flu problems. But this is a very different symptoms, new loss of taste and smell. So if you are aware you have loss of taste and smell, you'll be very cautious. 所以如果大家發覺突然間味覺、嗅覺消失咧，就要好小心啦。So what should you do? I think it's very simple. You could just go to the doctor. Now everybody in Hong Kong or wherever will do probably a quick test for you. 而家大家如果有懷疑，差唔多個個都做呢個 test 去 test 你冇呢個COVID-19 嘅啦咁 what's the emergency sign? I probably don't favor the emergency sign here. Probably by you, as long as you had flu symptoms, probably you feel you had contact with people with COVID-19. I think you should seek medical help urgently. 我諗都唔好等呢個緊急信號啦。如果覺得有咩懷疑，最好睇醫生啦。尤其是你接觸嗰啲肺炎病人咧，就即刻去睇啦。especially you have suffered from shortness of breath, chest discomfort, confusion, inability to wake and stay awake. This means you have suffered from suffocation. You have those symptoms. Probably you should see the doctor as soon as possible. 呢啲咁嚴重嘅 symptom 咧，呼吸困難心口痛 暈暈地口水發藍，呢個代表係窒息啦，咁立即要睇醫生 ，maybe call ambulance 可能甚至要打電話救傷車So I think probably everybody know how to prevent the spread of disease by now. Okay, everybody in Hong Kong probably those who live in Hong Kong, you can see people always wear a mask, keep a safe distance, 6 feet from people, so wash their hand on a regular basis. Usually bring the alcohol around and then probably clean your hand on a regular basis. 大家都識啦，喺香港我諗住嘅話，如果喺其他地方嘅話，都係戴口罩啦、洗手保持距離咁樣So now we go into another topics. Why we should receive vaccination? Now we can understand all the seriousness of the disease, the complication, and how it's so contagious. 大家都知道個病好嚴重啦，亦都好難。其實基本上冇藥醫啦，咁大家咧點樣去保護自己咧？Now we have now 2 different vaccines available in the world, and in Hong Kong we have only 2 to protect your loved and your communities. Fight against the infections. We know we have 2 available vaccine. One is mRNA vaccine, and the other one is the inactivated vaccine. Now we have basically in Hong Kong we have biotech available, and in the rest of the world we have Moderna vaccine, AstraZeneca, and Johnson & Johnson. So all studies show the mRNA vaccine you need 95%, and Johnson & Johnson 85%. The good thing about Johnson & Johnson only need to receive 1 dose, and the rest of this you need to have 2 doses. And even Sinovac, they have shown different studies from 50% to 90% effective against the symptoms, and reduce hospitalization by 85%, intensive care visit by 89%, and death by 80%. 大家都知道我哋有2種呢個疫苗啦，有叫做 mRNA 疫苗啦。頭先我開始講嗰時，另一種咧係啲滅活疫苗啦。咁biotech 咧就 95% 啊 ，Moderna 90% protection。Johnson Johnson 咧就好處就係打1針就 85%， 而 Sinovac 咧有唔同嘅 study 講有50到90% protection， 住院重症同埋死亡率都減低咗嘅。So how does the vaccine work? So all those 3 vaccines already received the emergency use. Now I think probably all the vaccines are named here have approved for the WHO. So this few vaccine is mRNA vaccine, and the Sinovac is the inactivated vaccine. So I just now I say the mRNA, what does that mean? Because we had a spike protein, as I mentioned in the early picture of the virus. And mRNA is a messenger mRNA. Once they inject it into our muscle, they will induce our body to produce some spike protein. Because I mentioned, the virus needs the spike protein to penetrate our human cell. If the mRNA vaccine injected into the muscle produces spike protein, our immune system will trigger immune response. Our immune system will fight against the spike protein. So without spike protein, the virus cannot penetrate into our human cell and cause the protections, give us the protections. While Sinovac is inactivated virus, it kill the whole virus and inject it into our human body and induce the immune reaction. So it's a little bit different. 呢個滅活疫苗咧，唔係呢個biotech 咧 ，Moderna、Johnson Johnson 呢啲叫 mRNA 疫苗咧。咁頭先我講書咪話個病毒表面有個刺針蛋白嘅，有個針刺蛋白嘅。嗰個針刺蛋白嘅病毒咧係靠個針刺蛋白咧穿入個細胞度感染啊嘛。咁而 mRNA 疫苗咧，佢就打咗人體之後咧，佢就刺激我哋啲肌肉咧產生啲刺針蛋白。咁身體就會對呢個刺針蛋白產生一個抵抗嘅能力。咁造成嘅嗰種病毒咧，佢需要靠刺針蛋白穿透我哋細胞咧，而因為我哋身體對個刺針蛋白有抵抗能力咧，所有細胞咪變咗係入唔到我哋身體啦。而呢個 Sinovac 咧，佢就係一個滅活疫苗，佢將個病毒全部殺死咗，做成疫苗。咁注射入人體之後咧，身體就對呢個病毒產生抵抗能力啦。所以原理其實都好相近嘅。咁 how does the mRNA vaccine work? As I mentioned now, and to trigger the human cell to produce spike protein is the photo here. After the protein are built the vaccine mRNA is destroyed by the human cell. So the body immune system will recognize this foreign spike protein and build antibodies against them. So if you want to have antibodies against the spike protein, even you had infected with COVID-19, you have antibody against the spike proteins. So you not get infections and you protect yourself. mRNA vaccine is not a live vaccine. So live vaccine is not injected in the human cell. So it's very safe. So you cannot get COVID-19 from the vaccine. And the vaccine will not alter your own genes because people worry about this mRNA vaccine will alter your human gene. Because the mRNA vaccine is very fragile. That's why you have to store under -7°C. In fact, it's enclosed in a lipid cell. So once it produces the spike protein, the mRNA itself will be destroyed by our human cells. So it will not alter our genes. So don't worry. People had a rumor about this new this can change our genes, but this is not true. 嗱，頭先我講咗解釋咗 mRNA 咧，就係佢令到身體製造啲蛋白嘅指令。咁咧打咗入身體咧，身體就會對嗰啲 mRNA 咧就指令咧製造好多個蛋白出嚟。咁身體就對啲針刺蛋白咧產生抵抗能力咯喎。咁如果你有對嗰啲針刺蛋白有抵抗能力咧，咁咧你就會感染咗 COVID-19 之後咧，即使係感染得早咧，嗰啲針刺蛋白入唔到你身體嘅，咁嗰啲 COVID-19 嗰啲病毒就會自然死亡。你可能短暫帶嗰啲病毒，但係你就好難傳染到俾人，同埋唔可以輻洗繁殖，你又唔會病啦。所以你咪變咗係好安全咯。同埋呢個疫苗咧唔會改變你嘅基因嘅，你哋唔使擔心嘅。因為開頭我睇好多傳言話呢個新技術，哇改變人類基因嘅喎，其實咧應該就唔得嘅。大家可以放心。So this is the diagram. So this is the virus, right? These are the spike protein. So it looks a bit complicated. The whole point is this is the coronavirus spike DNA. The DNA injected into a human cell. I think you focus on this side, mRNA vaccine. mRNA vaccine, okay. So this is the mRNA vaccine encoded in a lipid cell, all right. So they inject it into our human body. So this will direct our human body to produce some spike protein in here. Because the spike protein are foreign antigens, so our human body will develop some antibody to against the spike protein. When in fact you meet our virus here, because the spike protein has had an immune response against it, that's why the virus cannot penetrate to our human body. 係啦，就好似頭先我講一樣嘢啫嘛，就係佢將啲mRNA 咧打入身體之後咧，個身體指令咧製造啲 antibody 出嚟，咁啊攻擊啲 spike protein。咁個病毒咧就靠呢啲 spike protein 去攻擊個身體嘅嘛，佢穿入個身體度，因為我哋身體已經攻擊晒啲啦，佢入唔到我哋身體啦。就係咁簡單嘅啫，唔係好複雜。So the efficacy, the biotech efficacy is very high, 95% against infection, 100% against complication and death。差唔多係95% 咧係保護㗎啦，唔係好強。100% 保護呢個併發症同埋死亡。而包呢個 Sinovac in Brazil, they say it's about 50%. In different studies, they up to some to 80-90%。就保護能力都唔錯嘅，都係根據 study 講。咁I think probably the model countries in Israel, because 呢啲67% of people in Israel already received the vaccination, especially the old people. And this figure look a bit complicated, but you can see the figure here. The overall efficacy is 92%. And it got reduced the infection rate to 94% and reduced hospitalization 87%, complication 92%, and 100% protects against death. So it's very good figures, the biotech, I think. So you can see 60% Israel people already receive vaccinations, and the disease all go down. The death rate probably you can check into that. you really go to 0. So now don't have to wear mask nowadays in Israel. And the COVID studies in Brazil, they say 100% prevent serious infections. Nearly 80% prevent mild cases and 50% overall prevent the disease. So it's still good. If you have choice, to be honest, I have received F.R.A.C.G.P myself, but for some people worry about some serious side effects, you can consider having Sinovac as well. So that's the key safety efficacy data available. 嗱，呢啲係啲數據嚟嘅嚇，你唔睇唔同嘅數據睇到嚇。嗱 ，Biotech we have undergone 呢個 phase 3嘅 undergone phase 3 studies. They're all the figures. 嗱 for Sinovac 100%, 100%, and this one 98% will develop antibodies. So means once you receive the sufficient dose of vaccinations, your body will develop antibodies. 即係你打完針，你身體就有抗體嘅，好肯定係，所以唔使擔心嘅嚇。咁係唔同嘅 vaccine 都會產生嘅嚇。咁但係 look at the antibody levels. So the highest is probably the Pfizer 啊，最高嘅抵抗咧就係輝瑞3.8倍啊。其他 Sinovac 咧係細啲嘅，不過都有嚇。咁 Moderna 咧就2.2倍。I look at the antibody level. Probably the highest it probably belongs to biotech. Prevalence of serious side effects in current stage of development. They have all undergone stage 3 trial. 嗱，全部都做晒3期嘅研究嘅嚇。咁一陣間我下一張 I will tell you how to the efficacy against the variant. I will give you a slide later on, so don't worry. 我遲啲會俾幅 slide 嘅，幅 slide 講究竟對啲變種疫苗，唔係變種病毒有冇幫助啊？咁嘅 United States vaccination rate 嗱，美國嘅接種疫苗率咧都好高啦嚇。咁但係 see in these figures, people with 75 years age 嗱，75歲以上咧 ，80% already receive vaccinations. 65 to 74. 83, nearly 80%, more than 80% as well. Look at these figures. They receive the first dose, and 75% with nearly 70% with of people older 75 years age receive vaccination, fully vaccinated. 睇美國咧，全部都係大年紀人打晒針先嘅，唔似呢個頭先我話有個 misunderstanding 嘅 ，just like I mentioned about the misunderstanding about old people or people with chronic disease should not receive vaccination. But this is not true according to the United States figures. 嗱，呢個咧喺美國就發覺老人家咧大部分都打晒，80幾%老人家，相對香港只得20幾%陰公。So the country with high vaccination rate with lower death rate 嗱，種得越高嘅國家咧，死亡率越低嘅。呢個你表你睇到咧，以色列 look at the Israel, there's nearly 60% of population have vaccinated. And have very low, Israel in here, very low death rate. Israel high vaccination rate, low death rate. 高接種率，低死亡率。United Kingdom as well, high vaccination rate, low death rate. India, low vaccination rate and very high death rate. 所以咧，接種得越多疫苗嘅國家咧，個死亡率就越低。唔中疫苗國家死亡率相對就高啲嚇。咁就 vaccination safe for people with diabetes. All current vaccinations appear to be safe and effective again for people with diabetes. It's already have rigorous clinical trial tests for the safeties. And the first trial including 3,000 people, but in fact, according to the Disease Control Center, they have 80 million figures now, so 80 million people. So you don't worry too much. I will tell you the side effects percentage. In terms of the racial and ethical diversity, we have improved different races too. 嗱，我哋喺美國做多咗研究嘅咁初期咧就做咗，主要糖尿病咧有3,000個糖尿病患者 just now 3,000 people with diabetes. Oh, sorry. Look at the figures. CDC from the Federal Drug Administration and Disease Control Center. Then the figure is confident is very safe and effective preventing COVID-19. And the potential benefit certainly outweigh the risk of the disease. And the success having the thrombocytopenia syndrome is very low and reemergent. But this side effect will not happen in biotech, only associated with Johnson & Johnson vaccines. So don't worry about biotech. In Hong Kong, we don't have this vaccine here. So you can compare here. So the risk with the Pfizer, 1 million dose, 0 cases. Mandela, 84 million doses, only 3 cases. AstraZeneca, 20 million and 79, and 1 death per million. Probably it's not related. I don't think it's related. So lesson learned from the Chile and India. Chile, they saw Sinovac is not very effective after 1 shot, and 67% effective after 2 weeks after second doses. So make sure you should receive all the vaccination. Don't skip one. Okay, make sure you receive 2 doses. So possible infection after vaccinations. The figure is very minimal. Look at these figures. COVID-19 vaccination breakthrough infection report of CDC。呢個睇下打完針會唔會感染咧？咁你睇到個總計好低嘅0.008%，打咗針都會感染嘅嚇，不過好低同埋唔 serious 嘅。You can look at the figure. Even you have received vaccination, you may have some chance to get the infection, but the infection usually is not very serious and usually without any complication and death. So the case is very low. Look at these figures, and in 87 million people, and only 7,000 people around get infected. But usually the disease is very mild. And look at the female figures about this, and older people had higher chances, and some mainly have severe infections. And over 87 million people, around 88 people die. So 1 in a million. Without injection, the death rate in old people is higher than 10%. In here, only 1 in a million. So it's very safe. So there's no excuse not to receive the vaccination. 嗱，呢你睇到咧，打咗針咧，就死亡率都係8000幾萬個得88個，咁100萬個得1個到嘅啫，所以非常之少嘅嚇，所以冇理由唔打針。咁如果你係惹到個病咧，你嘅死亡率係2% 平均，而老人家係去到10% 嘅，即係100個有10個會死，而呢度咧打咗針之後咧，100萬個先得1個會死嚇，所以係好低嚇。So people worry about, oh, do I need to receive booster dose after a few years? The figure is not really known, but according to the recent study, the mRNA immunity can last up to 3 years for healthy individuals. 健康嗰啲人咧打咗針，成日我好多病人問我啦，打咗針會下年又要打㗎啦咁。其實而家維持到係兩三年嘅嚇，咁至少保護咗而家呢刻先啦嚇。但係 more data will be available with time 嚇，遲啲會多啲數據嘅。而 they say the immunities with people receiving mRNA vaccine will have longer immunity 嚇，打 mRNA 個維持嘅效用係耐啲嘅嚇。所以咧係我自己就打 mRNA 疫苗嘅嚇。嗱 ，this is studies. This is week 1, week 15, week this after 2 years. So the immunity level is still very, very high. Different age group. The older, the younger, the immunity will last longer. So it's up to 3 years, 2 to 3 years. You can see up to 2 years still the immunity level in here. So you can guess probably the immunity will last for a short while. So worry about the side effects 啊，有咩副作用咧？好多人擔心副作用喎，係咪？咁 when you receive a vaccine for particular virus, your immune system will build protections against it. and your own body will produce antibodies. And you probably will experience some normal side effects. I wouldn't say side effect. I wouldn't say it's a normal response, because the purpose of having vaccination is try to induce your immune system to have some immunities. 我打咗針咧，人話有冇副作用啊？咁打咗會痛，我唔會覺得係副作用咯。如果打針係嗰啲正常反應，因為你打針就想有反應㗎嘛，係咪？所以咧，其實係唔使太擔心嘅。People with diabetes should monitor their blood sugar. Maybe you may have to take 1 or 2 or 3 days sick leave if you need it. 嗱，如果糖尿病患者因為個 glucose 所以會睇得好啲咧，咁甚至可能考慮休息1、2日啦嚇。咁 as far as I know, I have patients come in after vaccination. Usually they feel a bit tired 1 or 2 days or most 3 days, and rarely last more than 3 days. 通常打針睇嗰病人多數啲感冒攰嘅感覺1、2日、2、3日到，休息下就冇事嚇。咁 this is a common side effects 啊，最常見嘅 side effects 啦嚇。Usually pain over the vaccination site， 打針啊針口痛啦，有發燒啦 fever 啦，會發冷發熱啦，會 chills 啦，會 bit fatigue， 會 feel fatigue， 會 bit headache, losses, muscle pain. It's a very common side effects. I think this is among 5 to 10% people receiving vaccination will have those side effects. 5到10% 人有啲輕微嘅反應咯，都係1、2日嘅啫。So this is a side effect result of the immune system response. So don't worry about too much about this. What about the allergic reactions? 有咩嚴重化問咧 ？According to CDC, they say in 1 million people, around 4 to 10 people will have a very serious allergic reactions. 美國 CDC 講咧就100萬個人有4到10個人有嚴重過敏反應嘅。咁但係都係打腎上腺素就冇事啦。They can be treated by adrenaline injections. Usually is only last 1 or 2 days. 通常1、2日就好翻。According to Hong Kong studies, we have already received give 3.3 million dosage. 喺香港係打咗330萬針。And according to the health department, there's only 1 allergic reaction happens. 第一針嘅即係有一個人出現過敏反應，嚴重過敏反應嘅。咁 in Hong Kong we have an allergic center in Q.M. Hospital. For those who concerned about having a serious infection with flu vaccine, probably can make an appointment to the Q.M. department to do some allergic tests. 如果你係之前有對啲嚴重，我知嚴重嘅過敏反應，我唔係普通敏感嗰啲，就可以去喺個瑪麗醫院咧去門診，去個敏感部門嗰度咧做啲測試嘅嚇。So other side effect now you people talking about the carditis, pericarditis in the young people. 嗱而家有啲人講話打個 biotech 有啲係心肌或者心膜發炎。咁 in the United States, probably only people around 15 to 30 years age, 15到30歲會有見。But the case, the incidence is very low. It's 1 in 100,000， 即係10萬個有一個度 ，1 in 100,000。And usually the disease very short-living。個病好短嘅，同埋 usually the patient recover by itself with a very short period of time and not usually serious。我諗啲後生仔好快都復原咧，同埋唔嚴重嘅。So another more side effect people are concerned is the because of Bell palsy。好多人擔心話打完針面歪咗咧，咁個 case is not very common in Hong Kong。We had nearly 3 million dose。香港打咗300萬針啦。The facial trouble palsy we were 1 in 100,000。我哋衛生署組話10萬個有一個度啊。咁 usually the palsy problem is only last for a few days or maybe 1 or 2 weeks。通常係1、2個禮拜就好翻嘅。So and compared to the seriousness of the disease, I think the side effect of the vaccine is not serious。相對個病咁嚴重咧，個打針嘅危險性唔係咁高。So consider the chance of getting disease. Now we look at the figure I showed you the incidence. Your chance worldwide to get the disease is 1 in 100, maybe 1 in 10. Probably varies in different countries. In Hong Kong, we have already more than 10,000 cases. 全世界嚟講咧，你惹到個病咧，視乎喺邊度 有啲地方可能1/10機會惹到，有啲係1%機會。喺香港咧就可能幾百分一機會惹到。But once you get it, you will suffer. The whole family will suffer. You will suffer from very serious complication. 你一惹到咧，你就會好慘啦，因為你會好嚴重啦，同埋好多併發症啦。So you consider the 1 in a million chance of getting allergic reactions. The risk of having the vaccine is very low. 你諗下打針係100萬個得一個，咁你其實你個病咧個嚴重程度好高咯。希望大家識計咁嘅計數啦。So for those with diabetes, will the vaccine affect your blood sugar? Probably not really. Make sure you have good under good controls. Make sure you have sufficient water. Make sure you're in sufficient rest. So usually people with diabetes doesn't have major side effects. 糖尿病應該唔使太擔心。總之你控制好個糖尿病，飲多啲水，休息夠嚇。咁 does the diabetes medication affect the vaccine? No information available yet, but no evidence too. So I don't think I worry most of people stop all the medication before vaccination. Try not to do it. Probably just take your medication on a regular basis. Don't stop it before any vaccination. If you want to do anything, please ask your family doctor first. 大家我識好多病人咧，打針前話停藥唔食藥喎，呢個唔係幾好嘅。如果你諗住停藥食藥咧，你最好問咗你嘅家庭醫生先。Okay. So it's not advisable to stop all your medication before vaccinations without doctor's advice. 冇醫生嘅提議，千祈唔好亂做，唔好亂停藥。So yes, you want to people recover from COVID-19. Should you still got vaccinated? According to the indication in Health Department Hong Kong, you can receive one dose will be sufficient. 係嘅，需要打針嘅。即使你好翻咗咧，你都要接種疫苗嘅，打一針就夠㗎啦。就 usually you have to wait 90 days after the infections. 90 days 等感染後90日咧先再種疫苗。But one dose will be sufficient. 打一針就夠啦，唔使打兩針。So if you recently test positive for COVID-19 or currently experience symptoms, so please stay away from other people. 如果你有 COVID-19 嘅又接觸過，咁你企啦，要隔離咗自己啦。If you test positive for COVID-19, wait until you recover. 如果你係有好翻嘅，你都要等14日啦。咁 if you experience COVID-19 symptoms, isolate yourself. 呢啲我諗大家都識啦，唔使我哋講啦。如果捉到即刻都要 isolate 啦。So if you exposed to someone with COVID-19, quarantine 14 days and monitor yourself symptoms. And also get a COVID test. If you got negative test, you should get yourself vaccinated as soon as possible. 我覺得如果你係驗咗血又冇事嘅，快啲盡快打針。So once you receive both doses of vaccination, it will protect you from getting sick with COVID. Yes, but usually wait 14 days. 打咗兩針之後咧，理論上咧你係安全嘅，最好等14日啦。But however, research do not know whether you will be able to carry the virus and pass it on to others. 你哋唔知嘅，其實just I mentioned, even you receive the mRNA vaccine, you still can get infected because it only gives you 95% protection. But usually even you get infection, it will be very transient. Maybe only last for 2 or 3 days because the virus will die by itself, since it cannot reproduce inside your body. But for safety's sake, you make sure you have to be careful. If you worry about you are silent carrier. 咁你打咗針咧都有少%會惹到病毒嘅，但係其實咧你就唔會感染嘅，同埋傳俾人嘅機會相對低，雖然有少少機會。咁我覺得你咪你咪繼續戴口罩洗手咯。If you worry that you have silent carrier, make sure you practice universal precaution, like wear a mask and wash your hand and all those things. Keep distance. 咁你最夠都保用呢個保護呢個社交距離啦，係啦。咁 2 weeks after your first vaccination, you'll be considered very safe. In fact, in Israel, America, you no longer need to wear a mask anymore. It's maybe a good news for us if your government will consider this. 其實你打咗2針疫苗咧， 其實你已經覺得係安全嘅，喺美國啊、以色列嗰啲可以除口罩㗎啦。So you once you got fully vaccinated, no need to wear a mask. Probably is a good news for us. No need to quarantine, unless you show symptoms. Say you fully visit unvaccinated people for single household who are at low risk for severe COVID-19 disease indoor without wearing mask or physical distance. You can see 你打咗針咧，其實基本上你其實好安全嘅。所以點解打針咁緊要咧？In the future, maybe you don't vaccinated, maybe you have probably limited chance to travel around the world. So it's another message advise you to get the vaccination as early as possible. 將來可能有啲 vaccine passport 咧，你冇打針都 travel 唔到嘅，所以我覺得咧，盡量都係值得去打咗針。好。Is the one dose vaccine, as I just now mentioned, one dose probably not sufficient. 2 doses, wait 14 days. OK， 要打晒2針先安全，唔好淨係打1針啊。咁就 Does the vaccine protect against a new variant of COVID-19? Or these are new topics 啊？因為而家有一個新變種啦，係咪打針可以完全保護變種咧？咁 research are now seeing to study a new variant of COVID-19 啊。咁而家研究緊，不過我有個表嘅，但係都有啲數據嘅嚇，大家唔使太擔心。咁我哋睇睇個數據。This is the table I showed you. We have the original virus here, and we have UK virus, South Africa virus, Brazil, and latest Indian virus. Probably Indian virus is the most prevalent nowadays. You know, there's a huge incidents happening in UK now. But with people will receive biotech, they have 95% protect the original virus, 87% protect UK, 75%, and Brazil may be more, but not no more. We need more data. And even for Indian, 95%. 75%. Sorry, 75%. So for most of the mRNA vaccine, pretty much the data pretty much similar, but the Sinovac data is not much. So you still may have to wait for the Sinovac data. So that's why I urge people to receive biotech at present. This is my personal choice, but you have make your own choice, of course. 呢個所以咧，因為呢個 Sinovac 咧，你見唔係呢個 biotech 咧，佢保護能力基本上好多變種都唔錯嘅。所以我自己就打咗啦。但係大家睇完 data 可以自己真係認真考慮嘅。而我哋香港就 Sinovac 咧，暫時嘅 data 就唔好明顯嘅。咁所以大家要小心考慮打咩 vaccine 咯。So talking about the variant, we're talking about the antigen drift and antigen shift. What's antigen drift? Means virus, the spike protein or the genetic material sometimes can mutate, undergo mutation over time. But these two viruses have not a similarity. So the original vaccine may have offered this virus to some protection, some mutated virus B, some protection. But with antigen shift means they have two different viruses, they combine into new strain of virus C. If this happens, this is very troublesome because the vaccine will not protect the new strain. So now all the variants probably undergo antigen drift, not antigen shift yet. So it's still we have, the vaccination we now receive can still protect the variant. 我哋有呢個抗原嘅漂移咁咧通常咧 A 變種咧佢好多時會有不停咁轉變嘅，自己都會有 mutation， 會啲基因會不停會突變嘅，咁會成為另一種病毒。但係咧呢個由呢個變過去咧，兩個都好多相同嘅，所以打咗啲 vaccine 咧都可能保護得到嘅。但係呢個就唔同喎，呢個係兩種病毒咧同一時間感染咗，而佢哋喺個身體嗰度咧合併成一位新病毒，呢個叫 shift。咁呢啲咧就個針咧係難啲保護，希望暫時冇發生呢樣嘢。So as we have some share some cases, Singapore Ministry have released some data of recent hospital outbreak. It's mainly on the Indian variant. All the staff has received biotech vaccinations, and among those 40 hospital staff, and 9 received 2 doses only had mild symptoms, and none of those need oxygen support. The remaining 31 cases without vaccinated and require oxygen therapy, and 1 people died. So may not protect infections, but at least will protect you from getting serious disease or death. 新加坡最近咧，你睇到40個人咧感染咗，打咗針嗰啲咧就好輕微症狀，冇打針就嚴重好多。所以理論上咧 ，Biotech 咧，佢其實唔單止係呢個 studies，not only this study，not the data show Biotech offer a lot of protection against different variants。好啦，咁contraindication of having Biotech。Basically, no. We only focus on here. Unless you had serious allergic reaction in the past, everybody should receive Biotech. That's all. So skin allergy is not a contraindication. Eczema, not a contraindication. People with chronic disease is not contraindications. But on top of this, there's some other condition with people with very sick with chronic disease, which their failure is very serious, or they have a very low platelet count, or they have have a major heart attack, then they should wait. Or else, all people should consider with stable control, hypertension, diabetes, heart disease, should consider vaccination as early as possible. That's the leaflet from Sinovac. And very difficult to find, but they say people with a history of asthma, allergy, some all those conditions should be more careful. But it's not a contraindication. 喺 Sinovac 佢哋個針個 leaflet 佢都有寫到，有呢啲病咧會小心啲，但係唔係可以打嘅。所以兩種針都可以打。所以 in conclusion, 2 vaccination are pretty safe. So what about in future? Already toward the end of the presentations. Now we have more 13% of vaccine has approved, but more is coming. So hopefully some vaccine will probably be more powerful and probably can cope with other variants. So it's left to the science to decide. So now we have already a new vaccine called Novavax. It's a new vaccine. It's called a protein subunit vaccine. Exactly, they just contain a spike protein. Unlike the mRNA vaccine, they have a spike protein in the vaccine. Once you inject the spike protein vaccine, your body will develop immunity against the spike protein. So phase 3 trial, very promising, 90% nearly, and strong immunity against new variant, and very easy to distribute and store, and it's very safe to old people. 新一種病毒咧，咪有一種新嘅針咧，仲好嘅，就叫做 Novavax 啦。佢咧直頭係一個 spike protein 嘅 vaccine， 係一個針刺蛋白嘅 vaccine 嘅疫苗嚟嘅。咁90% 嘅。咁咧佢發覺咧保護啲變種嘅，老人家特別容易好嘅，少啲副作用添，同埋好易儲存啊。咁所以將來我哋大家唔好太擔心我哋將來發生咩事。Okay, so if you receive vaccination, you don't have to wear a mask. It's probably some policy of some country. Hopefully, it will happen in Hong Kong as well. 希望第時打咗針就唔使戴口罩啦，咁慘啦，係啦。咁所以to conclude, please have your vaccination as early as possible. Protect yourself, your family, your loved one, your communities, and your wealth. 希望大家聽完之後咧，解答到大家好多嗰啲誤解啊！希望大家能夠打針。Thank you.
Oh, wow. Gee, this is such a great webinar. I must say thank you very much, Professor Lamau. Really, to me, I learned a lot, and it's really, really not only informative, but it's so, the information are very rich. And now you guys can actually ask yourself whether vaccine is really good for you. And if you have not registered to do vaccination, better think about it very carefully, because this is really, truly something that you really got to seriously consider and do this quickly. So we have a question here. The question is, when you do Sinovac, would it be approved by EMA? So travel Europe, can it be? EMA is European, I guess, I don't know. This one, I'm not sure.
I think EMA so far only approved the mRNA vaccine.
Okay, well, for now, it's only approved the MI, but probably eventually they will, but you just got to keep looking at it, okay?
Yeah.
So what about, do we need a booster? So people who already maybe start off with a, I guess Eugene is actually from Hawaii, and he has probably he did a Pfizer vaccine. So do you really need a booster?
Look at this slide already mentioned in the presentation. So the vaccination, the immunity can be last for 1 to 2, 3 years. But more data we needed. It's the different age group. The immunity can see from week 1 to week 119. So you can see that after 2 years vaccination, the immunity still stay very high. So I think probably in the 1 or 2 years, I think booster dose may not be necessary. But more data is required to answer your question. But at this stage, get your vaccine first. Don't think about booster.
Okay, I guess we're all very clear. The key is get your vaccine first so you're protected. Worry about later booster. But booster could be 1 year later, but it's okay. But you already get protection. So you don't get serious sickness. That's the key. So that is very, very important. I hope everybody answers that. Are there any more questions for Professor Au? Because I think today is so lucky to have him to answer all the questions in front of a very knowledgeable professor to answer a question. So we're going to have a couple questions here. It's I'm fully immunized with Sinovac. It's okay to have a Pfizer booster to protect me from Delta vaccine. You know what? They already got 2 shots of Sinovac. Is it possible to do a Pfizer shot later on?
In fact, there's studies to show whether they should mix 2 different types of vaccine to give a better immunities. I think more data needed, but I think it's sensible questions. If I'm yourself, I probably will consider get a Pfizer booster myself.
Okay, so you might,
yeah,
if you can, yeah, because as you know, the vaccines right now is not readily available, so it may take some planning or getting that vaccine. So you got to really check that out. So are there any more questions for Professor Au? You got to ask any question. We hope that we answer you. Are there any more questions? Let me see on this end, up there. Any more questions up here? Okay. Okay, good. I think we have a lot of questions pretty much answered. Seems like, yeah. Okay. Oh, one more question coming. Sorry. Okay. I did get my vaccine with Deviant with the Deviant Pfizer and Moderna. Still suggesting it. Okay, Eugene, I don't really quite understand what you're trying to say. Can you ask the question a little more, understand what you're trying to address? Oh, are they different? Is it, that's what you're trying to say? Pfizer and Moderna is any different?
I mean, it's pretty much the same, Pfizer and Moderna vaccine.
All right. Yeah, according to the data, we saw that Pfizer and Moderna is pretty different, but it's the reaction, I mean, so is the side effect a little bit more on Moderna?
Moderna, because they worry about the thrombocytopenia, but it's still pretty rare. It's only in the young ladies. So
okay, so actually what Professor Au was saying that the Moderna and Pfizer about the same in sense of effect, but however, there are some really rare, very rare side effect of Moderna. So Pfizer is still really at this stage is a good choice, basically. But you still need to decide yourself. Is the Pfizer good, or in Hong Kong is the Sinovac good? Sinovac has less reaction. So it's not really up to you. You have to talk to your doctor and see what can be good for you. Okay. Any other questions? Are there any other questions? One more. How about boost? Well, we answered the booster shot already. So any other question from the group? So really, at the end of the day, I really thank you very much, Professor Au. You have such a great informative webinar. I hope everybody really listen to this. You can go get the vaccine, or you have to decide whether to go in the vaccine. And if you have not get it yet, do decide get vaccine, because really our heart here is this for you guys, because vaccination is such important your health and family health to really get that vaccine to protect you, not only you, actually your family. Because if you got infected, your family get infected, and everybody infected, then they might actually develop very serious disease, such as from heart, kidney, all the major organs could be affected. Could be also at the end of the day, the worst that you get fatigued, tired whole day long. I'm sure none of you guys want to have that. So net result, do think up seriously, don't get infected, and truly get your vaccination. Whatever vaccine you decide, but make sure you get it, because you're gonna get protected so you don't get infected. That is the key message here. And don't misunderstand. Really, if you're diabetic, or you're pre-diabetic, it is okay to take vaccination, right? Sure. Okay, Dr. Al has confirmed. Don't worry about if you're diabetic, pre-diabetic, you actually can do vaccination. Now, a lot of people also ask me, hey, matter of fact, yesterday there's a patient call already. They said, hey, I'm cholesterol high, I'm a high blood pressure high, and my blood sugar is high. Can I take the vaccine?
So get under control first.
Okay. What do we get under control?
Last thing I want to say is because there's still no cure for this disease, and masks will not protect you from getting the infection, and the only way is vaccinations.
Okay, so even my 3 highs, if I have high blood pressure, high sugar, and sorry, high sugar has to be somewhat well controlled, and then I have high cholesterol, is it okay to take vaccine?
Yes, certainly. I think probably you get it as soon as possible.
Okay, so the answer to some of my patients who call and say, hey, you know, I have 3 high, what will be the answer? Should I get a vaccine? Is the answer yes. Do go get your vaccine, according to Professor Al, because it really helps you to protect you from infections. Okay. One more question that one of my clients also asked. He said, hey, you know, I'm a diabetic, although I'm controlled my diabetes, but my blood sugar, although controlled according to them, average blood sugar is still 8-9. So according to, still on the high side to me, you know, if you're 8 and 9 daily. And they were worried that because they heard so many stories that diabetes, they die when they, some of the early cases of vaccination, either they die or they actually went to the hospital, they died. Well, if that's the case, is it related? I mean, I'm just trying to reinforce that to understand what is the situation if they're 8 and 9.
Say in Hong Kong, we have about 46,000 people die every year. So every day we have 130 to 40 people die. 95% of people die of chronic disease, maybe old age, maybe something else, and 5% die of accidents or some unknown cause. So in Hong Kong, we have now received 3.3 million vaccinations, and only maybe 60 people die over 3 to 4 months apart. So I think the people die, they will die anyway, without or with vaccinations. So I don't think the vaccination caused any death. In fact, they belong to the people should die anyway. So I will still recommend people to get the vaccination as early as possible.
So even though the blood sugar is 8 or so, they should still safe.
Acceptable. Yeah.
Okay, acceptable.
And consider the HbA1c should not more than 8 or 8.5. I think probably try to put the HbA1c under 8 before vaccination.
Okay, so under 8. Okay, remember the A1C under 8%, right? So if your A1C is under 8%, it should actually try its best to get vaccination. Remember that. That's what Professor I recommend. So really good. Any other question? If no more questions, I want to at this time take the thanks Professor Al to give us such a rich, thorough questions. Answer all our questions. Really appreciate it. You already see a lot of comments. Thank you, Dr. Al. Have such a great webinar, and thank you on the weekend.
Thank you.
And I think I learned a lot. I learned tremendously. And a lot of my clients also learned tremendously. I really appreciate that. And once again, thank you again for your busy Saturday, especially, stop your clinic to just come in and give us the webinar. Really appreciate from my heart. And our patient, I thank you. And also people from Philippines, Singapore, Malaysia, Hong Kong, also from Indonesia, Australia, America, also people from Hawaii, LA. All these people are in there, and they want to thank you very much too.
Okay,
Because quite a few from Hawaii actually say thank you. So thank you again. Thank you. Okay, take care. Have a nice weekend. Thank you very much. Bye-bye.